back to MS Talks 2.0 Let's Discuss Facts, a series brought to you by Novartis, and we're here to discuss the facts of multiple sclerosis and break down the common misconceptions. Being on a treatment plan for MS is crucial in controlling the disease, but MS also comes with symptoms that need to be managed. Joining us today is Dr. Maha Feda, consultant and head of the Physical Medicine and Rehabilitation Department of Reem Hospital, Abu Dhabi, to help us explore available supportive therapies and when or how they can be used within a treatment plan. Welcome to the show.
Thank you for having me.
So what are the supportive therapies that can be used for MS?
So usually rehabilitation works as a team. We have a multidisciplinary team in order to help these patients. So the team is built based on the physical medicine rehabilitation consultant, who usually sees the patient, does the full assessment, and then direct the patient to the appropriate therapy. The team also includes the physical therapist, who usually assess the patient's mobility, strength, endurance, and their need for any assisted devices such as wheelchairs, walkers, canes, and, like others, the assistive device. Then you have the occupational therapist, who usually assess the patient's ability to do functions of daily living, such as washing, dressing, eating, and all of those things, in addition to the cognitive impairments that they may have. So they do the assessment and work on memory, thinking, reasoning, all of those things. Then we have the speech therapist, who usually looks into speech and swallowing. So they do the assessment and management. In addition, also, they help with the cognitive part with the help of the occupational therapist and the neuropsychologist.
There's a lot there.
A lot of things.
And how can these different therapies be used in an MS patient's treatment plan?
So usually we should be incorporated in that treatment plan from the beginning and have, like a clear strategy for the patient. So from the time that I've seen the patient, we should have, like a clear plan and pathway on which specialty they need at every certain point of time. As you know, MS patient, they may have different relapses at different times that could result in reversible or non-reversible, like disabilities. So that is all being incorporated as a team, discussed with the patient being the center of that team, and having a clear, tailored program for each patient.
Okay, interesting. And what are the objectives of using supportive therapies?
So it's mainly to prevent complications and to maintain and improve the functionality of those patients as well at the same time.
And can you pinpoint at what point in the journey people should be seeking this type of support?
So usually it's from the beginning, from the first time that they're diagnosed with having MS and onwards, because usually their course of the disease is not known for most of the patients and even their neurologists and physicians. Mm-hmm. So they need to be seen by the rehab physician multiple times throughout their journey.
And you've mentioned so many different types of therapies. How can you determine which course of action works for each patient?
So when we see the patient, it depends on their symptoms. Like if they have problem with endurance, fatigue, strength, then we direct them to physiotherapy. If they're having problems with hand function, like weakness, they cannot dress themselves or wash themselves, then they go mostly to occupational therapy. If there's problems with cognitive, swallowing, and speech therapy. Usually there's a bit of everything, so they would need more than one discipline at a certain time.
Interesting. There's a debate around acupuncture. Can that be good or bad for an MS patient?
So there isn't that much research done on that part. But like the simple research that has been done did not say that it would cause any trigger, any relapse, or would harm the patient. So usually it's a good thing to treat some symptoms like pain, bladder dysfunction, memory, depression. So I would advise to give it a try.
Okay. And if a patient is experiencing pain as a symptom of MS, would you recommend physiotherapy for them?
So usually it's better for them to be seen by the physician first before going directly to physio, because it's a combination of different things. It could be either neurological in nature or musculoskeletal in nature. To determine which type of pain it is, they would need maybe sometimes medications, some interventions in addition to physiotherapy.
Interesting. And are there new technologies or advances in rehab for MS that you would like people watching to know about?
So there are a lot of emerging technologies in, like treating disabilities related to MS, such as gamification that has been used with physiotherapy. You have e-training, and also you have the robotic assistive training and or devices that could be used by the patients. We still need a long way to go in order to, develop even more appropriate robotic assistive devices. But I think we're walking on the right path, and hopefully it's encouraging for both the patient and the health coworkers.
I'm sure it is. Your insight is just amazing, so thank you so much.
Thank you.
Do you have any message for anyone who's recently been diagnosed with MS?
So I would recommend for them to usually come and seek rehabilitation attention, because that's a part where is missing in the loop and in the care, of the MS patients. So please, either myself or anybody who's in the field, go and see them and, just take advantage of what's available for this kind of disease.
Thank you so much for your time. That was MS Talks 2.0. Let's discuss facts.